Thank you very much. Thank you for the introduction and the invitation to come back to Korea. It's a pleasure always to come here after enjoying the tangerines in Jeju that Professor Park said will keep us young forever, and the beautiful seaside of Busan and the snow in Pyeongchang. It's now time to see the capital. So I'll build up on the presentations done by Jeff and Myung-Sing and Alejandro on the project, the ACT project that we've been speaking about. On the third component of it, the third output, and it focuses on the code of practice. So one of the new codex texts or standards that we have been working on. Wait too fast. So we have been covering all of this. This is the result of the task force on AMR. So there was endless discussions and a lot of hard work and commitment and compromises to put this new text together. And Alejandro just did a very good presentation on the guidelines of integrated surveillance and what they will mean for the countries in the near future. And I will be presenting the code of practice again as a result of all the work that came out of the task force on AMR. So the outline is very simple. I'll go over the details of the code of practice, the actual document. We have so many documents to read that often we don't read the one that we have. So I'll go into the details of the document itself, and then we will start this. I will present some of the implementation work that we have done in the 6 countries, and then what's coming up. And there's a lot coming up, and that's the most interesting and exciting thing. So you have seen this slide multiple times. In the center, you have seen the most important, relevant Codex Alimentarius MR texts, and on the left side, the handbook that you can actually print with the different standards. To start, I would like to call your attention for this paper. It's a very recent paper from the end of June, so about 3 months ago published. And I would like to congratulate these authors for their publication because they looked at the implementation level of the guidelines of risk analysis. So make no mistake, these are the guidelines of risk analysis that Carol Lee mentioned yesterday, and not the guidelines of integrated surveillance. So they are one of the 3 texts, but the guidelines on risk analysis. And when the colleagues in our department first introduced me to this paper, they said, "What do you think about it?" And my initial reaction was, they are looking at the guidelines of integrated surveillance. That would be about a 1-year-old document. But the guidelines of risk analysis is actually an 11-year-old document. And what the authors did was they looked at the level of implementation of these guidelines. And the main conclusion that they did was the guidelines have not been implemented. The key word of the paper is aspirational. These guidelines, countries aspire to implement them, but they haven't implemented them. And therefore, we still lack data to do a proper risk analysis in most of the countries. So this is the reality. So if you ask me if I was happy to read the paper, not really, because I like to see things implemented. That's what we all like at Codex. At the same time, the authors make a valid point, and it's up to us to change the scenario now with the 2 new standards. Again, as I said, you can print of course you can have my slides and the presentation, and in the bottom you see the link for the publication itself. And I find it quite convenient. It's like a handbook, and the actual code of practice is not a long document. It's a very juicy document with excellent content, but printed, it's about 10 pages. It's not a long document, but it has a lot of useful information. We go into the details. The previous code of practice is about 15, 17 years old, and there was the need to review it. Why was that? One of it is to broaden the scope of the definition of the food chain. So the revised code of practice, if you want, includes from the manufacturer of the antimicrobials to the actual consumer. All of us, we all consume food. That's one of the things that unite all of us. So the definition of food chain in this revised code of practice goes from the actual manufacturer of the antimicrobials to the consumer in our kitchens. So the scope was broadened. Then the longest section of the code of practice is the responsibility of the different stakeholders of the entire food chain. So, and the responsibilities on this, how to reduce or prevent the need to use antimicrobials. And the FAO will launch now in the WOW week an initiative on this, how to reduce the need to use, not just reduce the use, but reduce the need to use. And the third, there's a higher focus on the use of antimicrobials as growth promoters. And we know from the last report of WA that about 40 countries officially still report the use of growth promoters. So that's still a very relevant issue at the global level. So those were the main goals of the revision of this code of practice. Here are the contents, and we'll go into a little detail of all of them. So it starts with a very short introduction. We have seen this multiple times across this conference, the importance of AMR. The scope, a section on definitions, and if you have involved in global health policy, you know that the definitions are always tricky to get to a consensus, but there's good definitions there. Principles, responsibilities, practice, and then the last section focus on consumers. So there's about 7 sections of the document itself. The scope, so what's in? Above all, it's a risk management tool. It's a risk management guidance document. So that's the thing that it's the overall goal of the code of practice. It focuses on foodborne, and this seems silly to say it in this conference, but often if we get it, we are used to work in different sectors, and animal use, for example, plant use, but the focus is on food, foodborne AMR, and this is often not the case in many meetings, in many documents. As I said, it provides risk-based guidance, and it covers the food chain from authorization of antimicrobials to actual use, to the food consumption of the different consumers. And the main focus of the different antimicrobials is antibacterials. Some of the principles, some of the guidance might apply to other antimicrobials, like antivirals, for example, but the focus was agreed in the revision of this code of practice that it would be antibacterials. What's not included? Residues. Residues is not part of the code of practice. Antimicrobial resistance marker genes, starter cultures, probiotics, and biocides. So this is not part of the scope of this document. In the definitions, I will not get into the detail, but this is just to introduce you which definitions can you find in this document. And there is, of course, a definition of AMR and everything else. What does it mean in the code of practice? The extra label, use of label use, the food chain, food production environment. We heard from Louisa this afternoon about the environment, the definition of growth promotion, the definition of One Health. And then you have the prevention of disease, veterinary medical use, and phytosanitary use. This phytosanitary use comes from the broaden of the scope. Plants was included in this revision of the code of practice, and therefore what we were used to see in the standards of the OIE, or the World Organization for Animal Health, now needed to be expanded to phytosanitary use to include the use in plants and treatment of disease, as we are familiar. Now let's go over the principles. The principles are divided in these sections: risk management, prevention of these infections, responsible and prudent use, use of antimicrobials in specific circumstances, and surveillance. And Alejandro just finished his presentation on surveillance. Marcos emphasized the need to do surveillance of resistance, for example, in milk. And in the principles, I put here some direct quotes of the principles again, because if you read them, they mean a lot. In the principles to minimize and contain foodborne AMR, it says, regarding under this section of use of antimicrobials in specific circumstances, principle 12 states, responsible and prudent use of antimicrobials does not include the use for growth promotion antimicrobial agents that are considered medically important. And then there is a definition of medically important agents in the document. And again, principle 13 states, medically important antimicrobial agents should only be used for veterinary medical use or phytosanitary use. And I highlighted the word should, because should is a quite strong recommendation. It's not must, but it says should be used, how these molecules should be used by the different countries. In terms of responsibilities, as I said, this is the longest section of the code of practice, and this is divided by the different stakeholders, from the responsibilities of competent authorities to food, animal, and crop producers, including veterinarians, distributors, and manufacturers of antimicrobials. And again, the word should is there, that, for example, competent authorities should consider results of foodborne AMR risk assessment of sources that contribute to food production environment, example, the reuse of wastewater or irrigation or the use of manure. This is a very common problem in farms. For example, Marcos mentioned the dairy food production, and what to do, for example, with milk that has residues and goes dumped into the environment is something that I don't think we have the full picture yet. Again, competent authorities should establish systems for the monitoring and surveillance of foodborne AMR and AMU. And so Alejandro just presented the platform that will collect the data, and the code of practice very clearly states that competent authorities should collect data to contribute to platforms like this. There's a reference for the prevention of substandard and falsified antimicrobials. And then, interesting one, the word is different, and again, these are direct quotes of the code of practice, but it says, could improve the knowledge on behavior change. And AMIAS yesterday focused on the economic change or behavioral change. How do we buy? How much are we willing to pay regarding this? So there is a reference in the code of practice to the social science aspects of the AMR-related behavior. And it also goes to the level of the producers, and it says, producers are responsible for implementing health programs on their farms to prevent and manage disease outbreaks. Again, everybody has a role to play to control AMR, like we have been saying repeatedly, and there is now a standard of codex emphasizing this. And this is very important. We all need always a legal framework to state this, and now we have it approved by the codex members. In terms of practice, coming to the end of the overview of the document, this is interesting. Regarding the last stage of the food chain, it's a new section of the code of practice, and it says, food should be produced and handled in such a way as to minimize the introduction, presence, and growth of microorganisms, which apart from having the potential to cause spoilage and foodborne illness, can also disseminate foodborne AMR. So this is towards the end of the food chain. So we focus really the whole course of the food chain, from the production to the distribution. And the final section is this on consumers. And again, we are all consumers of food, and it says governments, food industry, and other stakeholders along the food chain should inform and educate consumers on the risks of foodborne illness, including infections, wheat-resistant microorganisms, and ways to minimize the risk of infection. So I went through the details of the document because under the ACT project, I only did the output. That means the implementation of these rules, these standards, in these 6 countries. Now we have a better image of what this means for these 6 countries. And this is the point. So this is where we are. After endless years, about 5 years, endless discussions to come up to this document, we now have it. And I tend to say that a document, if you print it, it's not very useful for people or for animals or for the environment. If you put it on your desk, it might just look very smart, but that's how far it goes. It's the implementation that can actually make a difference to the farmers, to the animals, to the environment, etc. And that's the focus of this output 3 of this project. This is where we are now. So we, as Alejandro, for example, mentioned, FAO has produced different tools for the benefit of the countries. And one of them is called the PMP, the Progressive Management Pathway on AMR. And this means putting in meetings similar to this one, the different stakeholders of the different countries to discuss where they are and what they can do better regarding antimicrobial use and antimicrobial resistance. So this is the actual picture of the meeting where I had the pleasure to attend in Cambodia, one of the 6 countries of this project. And that's what we did. We put the different ministers involved, all the producers involved, the different producers associations involved, and we discussed, what are you doing? How can you help it to get a better point? This will always be done in a non-judgmental way. We are not there to judge the country. We are there to assess and to support the country under the generous support of the Republic of Korea. So this is where we are, and from this output, the workshops, we get different needs, and that's what we work on. Oops. Okay. To conclude, so we have these tools, and one of the other questionnaire, I tend not to like it to call tool, because I find it just a questionnaire. One of the things that we are committed to deliver under this project is a questionnaire to assess, to help the countries specifically know where they are regarding the implementation of the code of practice. So we developed a questionnaire under these topics: One Health, growth promotion, surveillance, substandard and falsified veterinary products, the application of the WHO list of critically important antimicrobials, the use of prescriptions, and how many measures they are doing on a risk-based principles. So this is the questionnaire that we developed for this specific project. And it will look like this. It's a very down-to-earth thing, and we started thinking, divided all the code of practice in areas or topics that we were specifically interested, and then we actually put the principles that we are being monitored and the codes that are being monitored. And now, for the sake of time, I will not read them, but there's a principle specifically saying which molecules need a prescription to be sold. And there's 2 codes that specifically say antimicrobials should be sold upon a prescription. And again, now we have a codex standard that states this. This is very useful to have. And then the questions are down to earth. So we asked them, can I go to a country and get an antimicrobial with or without a prescription? So once we get these answers from the 6 countries, it will be even more clear where they are regarding the implementation of this document, the Code of Practice. And at the end, this is what we are doing. Where are you, and how can we help you to get to a better point? So for this is the homework that we did. The actual public version of this will probably be a professional version of SurveyMonkey. We discussed how to do it. It could be a database. It could be an Excel document, but I know all of you, I guess, we tend to be, just when you open an Excel, the blood pressure tends to go high if there's many rows and many columns and many tabs. So we thought that the professional version of SurveyMonkey would be more user-friendly. And to conclude, this is the field questions, and there's a legal complement to this questionnaire, in the sense of, we ask, do I need a prescription to get an antimicrobial? And lawyers ask, is there a law that requires a prescription to buy the antimicrobial? So they are similar, but not necessarily the same thing. And for example, from the workshop in Cambodia, there was clearly identification that they needed support to change some of the legal part of their legislation. And that's what we are going to do next. So to conclude, 3 take-home messages. I find these new codex, they are new, now they are about 1 year old, and the guidelines on risk analysis are 11 years old. Still, they are still relatively new, especially the new ones, represent an extraordinary global achievement. I mean, if you think 2 people to agree where to go out for dinner, sometimes it's difficult. And we have 189 members that agreed on each word of a 13 pages document. This is, for me, extraordinary, and it represents a lot of compromise from the different countries, and then the excellent share of Professor Park. The implementation can make, in fact, a significant difference, and that's what we are learning now from the countries. So 2 countries have already been assessed, Mongolia and Cambodia, and in the next about 4 weeks, I'll be going to Pakistan, Colombia, Bolivia, and Nepal. So in about 4 weeks, the assessment of the 6 countries will be completed to then start the implementation level. And the implementation can hopefully make a difference. And this is what has been repeated across the different presentations. All of us have a role to play to move them from aspirational, that was the conclusion where I started the paper that I presented in the beginning of this presentation, to reality, as we hope it will be in about 3-4 years from now. So it's time to implement it, and thank you very much for your attention.